Everyone, today we are going to see about the temporomandibular joints ligament. So first ligament is capsular ligament, the next ligament is lateral temporomandibular ligament, and third ligament is spinomandibular, stylomandibular ligament, and the pterygomandibular ligament. So these three ligaments are the accessory ligament of the temporomandibular joint. So these are the ligaments which helps in the temporomandibular joint. So we'll see one by one. First is a capsular ligament. So this is the capsular ligament. So capsular ligament gets originate from the all the superior articulating surface. As you know, the superior articulating surface is formed by the articular tubercle, mandibular fossa, and the squamotympanic fissure, and gets inserted into the neck of the mandible, posterior surface of the neck of the mandible. So you can clearly see this is the articular tubercle, and this is mandibular fossa, and this is squamotympanic fissure. So the next ligament is lateral temporomandibular ligament. So this lateral temporomandibular ligament is nothing but the thickening of the lateral surface of the capsular ligament. So it gets originate from the only the articular tubercle and gets inserted into the posterior surface of the neck of the mandible. The next ligament is spinomandibular ligament. As the name suggests, it gets originate from the sphenoid, especially over the spine of the sphenoid, and gets inserted into the lingula. So lingula is present above the mandibular foramen. So this is this sphenomandibular ligament gets originated from the spine of the sphenoid and gets inserted into the lingula. So this sphenomandibular ligament, it is pierced by the structures passing to the mandibular foramen, that is the inferior alveolar artery and the mylohyoid nerve. So embryologically, it is a remnant of the dorsal part of the Meckel's cartilage. The next one is stylomandibular ligament. As the name suggests, it gets originate from the styloid process and gets inserted into the posterior surface of the ramus of the mandible. So what is stylomandibular ligament? It is the thickened part of the deep cervical fascia. So stylomandibular ligament itself a thickened part of the deep cervical fascia. So that this is the stylomandibular ligament. It originates from the styloid process and gets inserted into the ramus of the mandible. This stylomandibular ligament divides the parotid gland from the submandibular gland. So it can be asked as an MCQ question. Which ligament separates the parotid gland from the submandibular ligament? It's the stylomandibular ligament. So it looks like a snake. So sphenomandibular ligament originates from the spine of the sphenoid and gets inserted into the lingula. And this is stylomandibular ligament originates from the styloid process and gets inserted into the posterior surface of the ramus of the mandible. And next one is pterygomandibular ligament. The pterygomandibular ligament originates from the pterygoid hamulus and gets inserted into behind the third molar. So what is pterygoid hamulus? So this is the posterior view of the sphenoid bone. So this is medial pterygoid and this is lateral pterygoid. So at the lower end of the medial pterygoid, this part is known as pterygoid hamulus. So the sphenomandibular ligament gets originated from the pterygomandibular ligament gets originated from the pterygoid hamulus and gets inserted behind the third molar. So these are the ligaments responsible for the movement of the temporomandibular joint.